We are grateful to be joined again by Dr. Bobbi Herzberg, and the title of her lecture is Polycentricity in the Age of the Coronavirus. Dr. Herzberg?
Thanks. It's a delight to be back with you again tonight or this afternoon on a lovely Sunday afternoon, at least out here in Utah. And after a long week of, I hope, very useful and important material. So it's sort of hopefully we can soldier through to the end here. I want to talk about a subject of polycentricity, and I thought it would be useful if we could talk about it in the context of a very current issue. Because one of the things about some of these theoretical puzzles that we've developed in academia and in public choice and Austrian economics and other fields is we want to be relevant to the subject matter that's going on and what people care about. And so I always like to, as I said yesterday, bring these things back to public policy whenever I can. And I think polycentricity is one of those arenas or one of those concepts that really allows us to talk a lot about how the US system of public policy operates and where we might be able to hone in on ways of improving our policy process, not by just borrowing from unitary systems of government, etc., but by really recognizing some of the unique features of our own system. So that's my hope for today, and let's go ahead and get started. It's a pretty huge topic again, but hopefully we can get through some of it and then just have a fun discussion about what this means in terms of coronavirus and some of the things that have been going on of late. So I want to begin by talking about what is polycentricity, and I'm assuming that many of you may not have a really good sense. You may have heard the term tossed around or seen it in articles, etc., but you may not have had any interaction in your own work. And so let's talk a little bit about what it is. It sometimes is confused with federalism, and we're going to talk a little bit about federalism as well, because they are related, but it is different than federalism. Polycentricity can exist in any different type of political structure because it has more to do with anywhere that you would have overlapping domains of responsibility. So certainly in a federalist system, it is structured in a way that would provide overlapping domains of responsibility, except in those settings where there's very strict division between the different authorities of government. So under the Articles of Confederation, there was not a lot of mixing between state authority and any kind of national or unified authority. And it was one of the challenges that they had. They needed a little bit more of some of the mix there. But you can have polycentricity in Europe, for example, in the European Union or within any single European country. You can have it across a lot of different systems. So how do we try and understand it? Well, it's wherever we have these sort of overlapping, where a single individual would find themselves simultaneously in multiple jurisdictions of collective authority. And how do those different authorities interact with one another in the context of that individual and the services that they may receive from government or the decisions that are made within those social settings. And so because of that, this overlapping and the multiple jurisdictions, it can get very complex very quickly. So the way that we often talk about it in the United States is to talk about we have the federal government and it has authority over certain areas. We have the state governments, and then we have local governments, and then we may have various service districts or other specialized like school districts or waste districts or any kind of special service. And policing might cover several different other jurisdictions, or it may be singular and completely overlapping entirely with a single jurisdiction. So we can have all kinds of models of this. So understanding how those different types of models work become very important if in fact we're going to talk about how a particular policy will play out. And we're seeing that now with the police example as well, and we're certainly seeing it in the area of coronavirus, where because different states, different localities have different venues for authority in these areas, sometimes those come into clash with one another, and it creates a bit of a challenge. So we want to look at the degree to which polycentricity can be a very big plus in the delivery of services, and also how it can be a challenge, and especially a challenge in a time of crisis. And so that's why this example or this case, I think, becomes a pretty interesting one. So one of the biggest advantages that polycentricity has is it does allow for the policy decision or the problem that we want to solve to be solved at the appropriate level of government or the appropriate level of social interaction. And so rather than taking every single decision to the national level and having them resolve it, which given the size of the United States and the diversity of the United States, often would end up being very problematic for large swaths of the country, you can resolve these things closer to the people. So what are the things that are usually resolved there? Well, they're frequently things where there is a high degree of what we call co-production between the individual, the citizen being served, and the policymakers and government entity that is actually carrying out the policy. So let's look at why polycentricity and co-production are so frequently linked. Now, this is a concept that was developed extensively in the work of Eleanor and Vincent Ostrom. I referenced that yesterday, and now has been picked up by many people and in many arenas. And so we see it in environmental policies, we're seeing it picked up in network theory and a lot of different areas. In addition to the way in which they tackled this problem, which was to use it as a way of looking at the issue of service delivery in metropolitan areas. So granted that the federalist system provided the ability of states and localities to deliver up services for its citizens, the question arises, what services are they going to deliver, and how are these going to link one to another? And how are people going to decide? So a lot of the work for the Ostroms starts in the late 1950s and early 1960s with the idea of sort of Thibault sorting, that in essence, people would select communities to live in based on the services that were going to be delivered in that community. So rather than require every community to look exactly the same, people could sort of organize themselves and either demand more services from their government and be willing to pay for more services through higher tax rates on themselves or some other mechanism, or they would ask for much less from government and choose to do it more for themselves or find some private arrangement for delivering the kinds of services. So there was a wide range of service delivery. And what that did was it led to this notion of, to what extent is my participation in this delivery of this good, to what extent does that shape how well the good actually serves my interest? So some of the goods where my behavior and my participation and my being involved with the product really makes a difference are things like education, safety, public safety, and health. So in education, for example, co-production, it's very hard to teach someone who does not want to be taught. it requires them to come with a certain willingness. Now, there are things one can do, but you're only going to go so far in terms of the production of the good. And so if we talk about co-production, it means the recipient has a role to play in whether or not that good can be achieved. And these are challenging issues for government because, again, government's good at doing things where I do it and it's done, but they may not be as good at doing things where I do it, but unless you're willing to meet me part way and actually participate in it, it may or may not be successful. And so in healthcare, we can really see that this plays out. So one of the real challenges that we find today in healthcare is so much of health outcomes that we ask government to assist us in improving and demand from them that they improve our health and provide all sorts of health coverage and health insurance and so on. But much of our overall health is a matter of our own behaviors and a variety of other factors. Very little of it is in that part of the equation that government or some external force can actually create. It requires us to be a party to it. And so whenever we have a good like that, where it requires us to be a party to it, in the case of good health behaviors, not overeating, not smoking cigarettes, getting exercise, not being around very dangerous circumstances, wearing seatbelts. I mean, a variety of things could be deemed to be public health issues, but they are public health issues where the individual themselves actually have much more control over whether or not that good can be produced. And so these co-produced goods become a real challenge for public policy. We want to hold government accountable. Why didn't you make us healthier with this huge expenditure of the Affordable Care Act? Well, because maybe it didn't target necessarily the things that were creating the health concerns that we have out there. And we see that very much in this coronavirus circumstance today, where how people are being impacted by it varies based on demographic factors that are not simply under the control of the health industry or government health policymakers. It's rather their behaviors that are maybe long-standing. So it seems as if, first of all, males are much more likely to be impacted negatively by coronavirus in terms of hospitalizations and deaths. And that might be a function of worse respiratory circumstances because of higher smoking. Again, a behavioral kind of circumstance, but it may be something else, maybe genetic as well. Additionally, we find poorer and racial linkages emerging out of the data in terms of the impact of coronavirus. And again, these are things where even with similar kinds of treatments and similar kinds of responses in these different communities, you might get a different kind of outcome. And so it's a far more complicated problem whenever you're dealing with a co-produced good. And so the government has to get us to behave in the way they want us to behave in order to create the good outcome. But in doing that, we may push back because there are other factors that may limit our willingness to do that. Our, desire for freedom, our desire to make our own decisions about how we live and how we eat and what we drink and what sexual behaviors we participate in and so on and so forth. So there's always this tension that exists in public health that has to go back to this notion of co-production. So one of the reasons I think that polycentricity is, in fact, a sort of promising way to think about these kinds of issues is the fact that we don't all share the exact same preferences and we don't all share the same willingness to accept risk or the willingness to accept constraints on our behavior. And because of that, and because we've sorted over time, often by region and by community and by the policies and the politicians that we select, and how we're pressing for policies in our state legislatures and at our local governments, a polycentric form that links more of that together with those diverse preferences is likely to be more successful. So as Alajika and Tarko note in their 2013 APSR paper on polycentricity and subjectivity, they say one of the most neglected facets of the theory of collective goods is the crucial role played by subjectivity. The extent to which a good is deemed to be rivalrous and whether it generates externalities depend on the subjective value estimations of the agents involved, and is not something intrinsic to the good itself. So in this analysis, what they point out to us is we don't all have the exact preferences. This is very frustrating for public health policymakers who want us all to see the problem through the lens that they see it, but we may see it in a different fashion, where our desire to be able to drink alcohol or smoke cigarettes or behave in certain ways, interact in public, go out and enjoy each other at a bar now, are going to be different than what they would want us to be. And one of the wonderful things about government that's sort of polycentric and a bit decentralized is that it allows us to sort of pick the politicians that are most compatible. Now, are we going to face sometimes more problems associated with our behaviors? Yes. If in fact we pick decisions that are inconsistent with what science might tell us we should be doing in these arenas, we're likely to pay more costs for that and have higher death rates and other higher morbidity and mortality and other negative consequences. But for a lot of people, that may be a decent trade-off. They may not be willing to trade cake for the rest of their life for the prospect of living 4 more months at the end of that life. You don't get back the 4 months between 21 and 22. You get back those maybe between 85 and 86, not maybe as beneficial to you, and you may be willing to make that trade in order to enjoy cake through your entire life. So the fact that we have these different preferences, if in fact we could find a way of governing across those different preferences, it's going to allow for more consensus and less conflict. If in fact we all have to be governed by the public health rules of New York City, where they control the size of beverages and the size and smoking and tax cigarettes at rates that many would not accept, and have very great restrictions on alcohol that sometimes result in $20 drinks, etc., etc. That works perhaps in New York and reflects the interests of the citizenry of New York. It may not reflect the interests of the nation as a whole. And so in doing that, polycentricity is one of those that sort of lets us find our medium and learn from one another. And that's also the lesson of federalism. So I want to link a little bit about how polycentricity and federalism link up. Federalism, by contrast to polycentricity is one where the individual is a member of many polycentric orders of collective action operating on them. And that's the way in which they're networked is between these different governance and institutions. Federalism has a rather specific type of structure, which can be polycentric, but is not the same as polycentrism. And so we can define federalism, it's the institutions itself. It can be the dual form of federalism is that earlier one I was talking about that's very strict with federal government gets to do this and the states have all of these other powers and there isn't that much overlap, or a more cooperative form, which is the form we've had pretty much since the New Deal and the last century, and that is everything is increasingly mixed, where there is a little federal piece, a little state piece, a lot of local pieces, and a lot of different levels of government actually acting upon the policies and the decisions. And sometimes those are a bit confounded and difficult to work out and create confusion in the policy. And again, I think that we see a lot of that in what has happened with respect to coronavirus, in part because as they're making decisions at these different federal levels, we've heard policymakers or politicians at different levels say, I'm in charge of this, when in fact, by sort of law and standards, that's not always the case. When they say they're in charge of it, it may be that the courts would not recognize, or that our legal arrangements of federalism would not fully support their statement that they have full control in these cases. And part of that is we're working it out as we go. Because there are so many interactions, linkages now, anyone can sort of claim anything, and then eventually the policy and politicians and the citizenry have to sort of sort it out. That's not really good in a crisis. It's better in policies where there's a long period where these things are operating and we don't have to have decisions very immediately. So we'll talk a little bit about that in a sec. So polycentricity defines the linkages across these different governing authorities. Federalism is sort of the governing authorities. And then the way in which we link these different organizations together is frequently through some mechanism of contracting. So a local district of some sort can contract with a different level of government to provide services. The citizen can contract with different levels of government, a homeowners association. And so there are formal arrangements for how these services are going to be delivered that go beyond simply the structure of federalism, or the, how we would draw this on the map and how the Constitution lays it out. It is very, very general. The specifics of how we do this tend to get written into these contractual laws and made in decisions more locally through the state. And so those are many, many different models. We can talk a lot more about that in the question and answer, but I want to get to this issue of finding the right level, because that is the most important. Is that might be that a policy could best be made by focusing on one level of a federal system, or a state, local, or national, even international. And so the policy itself will often suggest what level might best address that particular problem. But it may be that we just define that this level of government is going to address it. And it's not necessarily a function of whether or not they're best equipped to it, but a function of existing governing forms and constitutional limitations. As Alajik and Tarko note, a social system is this complex web of laws, contracts, cultural norms that can be seen as emerging from a co-production process, including the state and civil society. And as a result of that, it's why when you ask people who's in charge or who should I go to for this, frequently you can't get good answers. And it's because there are several different that you may have to check in with in order to make it. And that high informational, or that high level of knowledge that is required is a pretty high bar to meet for most citizens, especially when we consider how ignorant many citizens are about what is going on around them in terms of public policy and in terms of it. This is why for the Ostroms, they tried to push down to self-governance and to lower levels. And this is also the argument by Alajika and Tarko, that the logic is if you move to too high levels, you're going to have so much noise in that that you're going to have far more policy problems, except on those types of issues where that national level or international level is the right level for finding it. But most policies are not going to be at that level. Emergency circumstances create really difficult problems for us. One of the problems is that emergency circumstances often create a fiscal problem in terms of paying for the problem. So in a hurricane or in a disaster, then one area in this polycentric system may be harmed and need a lot more assistance, and that's where other levels and accompanying and coordinating levels at the same level, but in other arenas and other regions, can actually come in and help assist them. Again, this is one of those areas where coronavirus presents a second wrinkle for us, and that is it seemed to hit across the board pretty much at the same time, or at least the policies and the way that people started to tackle it were all at the same time. And as a result, that creates a much bigger fiscal consequence where it's hard to see what level can address it, because it has to be addressed at all of these levels simultaneously. That's an even more challenging emergency type circumstance. So I want to look at how polycentricity handled this particular emergency. And I haven't left as much time for the example, in part because we honestly don't know yet. We're going to have to look back on this with a little bit more sage thought and careful consideration, maybe a year from now, maybe several years from now, in order to be able to sort out what went well, what didn't go well, in the way in which we addressed it, and the extent to which our polycentric system can handle this kind of emergency circumstance. So I want to look at what happened under these emergency conditions. It's a problem, as I said before, that's different than other crises in that it's not consolidated in one area. It was sort of across the board, and that meant that decisions were being made across the board, but the nature of the crisis was not necessarily the same in all of these areas. And so even though there was a crisis, this public health crisis, and it was international in scope, the reality is the way in which citizens in any given community felt that crisis could be quite different. In New York City, the way in which they felt this crisis is quite different than the way that they felt about it and dealt with it in Utah. And the reason is just the degree of urbanization and how close people live together in terms of concentration of population in New York City, the use of mass transit, the use of elevators, high-rise buildings. There are a variety of circumstances that meant that dealing with this problem, even though the virus itself was similar and transmission was similar, the reality is the consequences of transmission or the frequency of transmission was going to be different in those two communities. As a result, finding something under a polycentric form that fits best in Utah versus one that fits best in New York is going to frequently look like they're tackling this problem somewhat differently. So there's going to be similarity, but there's going to be difference because there are differences in the way in which the crisis plays out and how much we have backup and so on. the power for dealing with this kind of a public health problem, I think it's very important to note that the power is in the states. It is not at the federal level. And that's one that gets us in trouble, I think, sometimes when we look at, well, what is the Fed doing about this? Why aren't you dealing with it? And the Fed stepping up and saying, we're going to deal with it and we're going to take charge and so on, that creates some confounding in the nature of how our federalist laws actually operate. The police powers are located in the states with only limited police powers at the federal level. And likewise, public health as an issue is addressed at the state level. And so it's not to say that the federal government is not involved in those areas. It's just that their role, much like these other co-produced goods, like education and public safety, the way in which those operate are largely directed by states and communities and not by the federal government. Often the federal government sets sort of broad programs and policies and sometimes some funding, but rarely does it have sort of on-the-ground implementation types of policies in these arenas. Sometimes it wants them, but the reality is there's a long history of this being done from the states, and that's exactly what happened in this. The coronavirus is all of the states stepped up and started taking action with regard to their states and wanting to address it. And that led to some challenges we see because each of them wanted to serve the citizens of their state. And that might have created problems for citizens of other states as they were buying up the ventilators or outbidding one another for the PPP and all of the different commodities that the supply chain was not always able to address as quickly as perhaps some of these policymakers wanted it to. Now, as I say, the feds don't have much of a role in the sort of core of this problem, but that does not mean they didn't play a pretty significant role with some of the things that they have taken on over time, especially since the New Deal and since the rise of regulatory bodies. So the CDC, the Centers for Disease Control, and the FDA, Food and Drug Administration, and then the health departments in various components, Homeland Security, various things, came into play with the policies that they had. But again, they are not core to this issue. And so they were often an overlay where it was more the politics of the way that this was going to be talked about than the actual authority to do this in a way that's really on the ground. Because they're not on the ground with citizens. They're not in the hospitals. They're not in this. And when we saw the Trump administration trying to address some of these things, we'll control the ventilators, we'll get them to you, we will send Navy ships to your port and so on, it often looked very clumsy and cumbersome. And in part, that is because that's really not an area that they spend a lot of time addressing on a regular basis, whereas at state and local levels, they're frequently dealing with these kinds of health issues and supply and other factors in their own community in terms of public health issues that come along and have fairly extensive. So how do they also deal with it? Well, we also saw cooperation and coordination across many states, so regions. So around New York, because New York has this spillover effect into New Jersey and into Delaware, into all this sort of eastern corridor there, because of the large metropolitan area and the degree to which people can come from outside, we do see these making pacts and learning from one another, trying to coordinate so that they could make better policies for themselves. But there's always a challenge in that. And the big challenge is, I want to serve the citizens of my state. And so I'm willing to come to cooperate with you as long as it's not going to cost me in my state. If my citizens find out I've sent ventilators to someone else, and now we don't have them, I'm the one on the political hook. So it's very hard in these crisis times to get them to respond appropriately with this coordination and cooperation. The states, as I said, are better equipped for a lot of reasons, but these are several I want to just run through very quickly here towards the end. Only New York, first of all, every state is different. That's why polycentricity is so critical, is it's that local knowledge, that local difference. And so what New Yorkers will tolerate in terms of regulation and government policies is not what they will tolerate in Utah. And so a politician here that tries to do that is going to get a lot more resistance than perhaps they're going to get in New York. So if we're making national policy based on New York stats and New York information, we're probably going to be making policy that doesn't work very well in lots of parts of the country, and people will become resentful and not willing to go along when there is the need for policy in their region or in their area. And I think we're seeing some of that. Many of the states that closed down early had virtually no cases, but now that they're opening up, they're getting cases, but they've already been closed down for 2 or 3 months. And so people aren't tolerant to stay home longer, but because it hadn't run through their community, and now they've opened up, and a lot of people from the more restrictive communities are coming in to those, and you get perhaps a new wave that's going to come through there. And so you get some of the challenges that says they did learn from each other. And so, for example, the New York policy that they pursued in the beginning, which was to get people out of hospitals as quickly as possible to recover in rehab centers and nursing homes. Well, what that did was it sent COVID into the nursing homes. We now know that it was a big, huge mistake and resulted in many more deaths than perhaps needed to happen. Again, they were trying to make sure that those ICU and those hospital resources were available for the most high need cases, but in doing that, they actually created a greater supply of those high need cases. And so learning from the decisions of others and making that available is one of the advantages of this type of a system. It's more likely, though, we're going to get good policy if, in fact, it is made more locally, in part because those local decision makers, as long as they have the information they need to make good policy, and they're getting advice and they're doing the analysis that's necessary, they're more likely to have the trust of their own communities and to take into account some of the special circumstances or attitudes of their community as well. And I'll just finish with this one because, again, I think this particular crisis points out many of the challenges that polycentricity creates. A public health crisis, especially one of this form, it's very clear that the reason that this became a global pandemic is in part because it was so transmittable across a very mobile society now. And so polycentricity and sort of locking people off into their smaller communities to make decisions may not accommodate or live up to the best policy making if, in fact, you're dealing with a policy that has these huge externalities, either that you transmit to others because you're not practicing as safe of behaviors, or they are coming into your community and you are more impacted and you're not prepared for it. Either way, those intermingling of society now in an age of technology, an age of high travel, global travel, is going to have challenges that local communities are going to have to address that are global in scope, but at the very least state and national in scope. And so that's one of the challenges. How do we get them to incorporate that? So one of the things you hear now is, why won't Alabama behave? Why won't, some of these Florida, et cetera? Look at those huge number of cases that are opening up. again, they're responding to their citizens, they're responding to these other demands that they're making, the risks associated with other health concerns and the risks that are associated with economic decline. And they're weighing those in a way that their citizens are appreciative of, but there's the worry that then that is going to lead to an externality that creates a second wave or continuing of the problem even longer. The speed of contracting arrangements has always been a problem. So again, in finding ventilators and finding materials and deciding where they should go, every state for themselves meant that a lot of them were going up and buying it up when they only had 10 cases. Whereas New York, which was inundated with cases by the time these things started to emerge on the national scene, obviously had higher demand at that time. And so that's where the federal government can play a coordination role, or these regional pacts. But then we're also going to see them blamed because they don't have all the information they need from these local levels. And then the politics. At the end of the day, this is all about politics. They may want big change. They may not care about little things. They may want to be able to take credit for being decisive. So locking down an entire state is the decisive action. And they may not have to pay the consequences of what that actually costs to the individual citizens and businesses, especially if people blame the virus rather than blame the politician and the policies that they made. So this creates a much more fluid but challenging situation.
So first, polycentricity sounds very familiar to the principle of subsidiarity. How do these relate to one another?
Well, I think there is a lot of similarity between the two concepts, to the extent that if you have multiple centers, then the problem should define which center is appropriate to dealing with it. So if you think of subsidiarity as dealing with the smallest level that's capable of dealing with the problem, then that would be comparable to polycentricity, except for one sort of factor, and that is the other centers don't go away in any given problem just because it is being addressed at one level in a polycentric system. And it's the multiple access points. So one of the things about federalism that Vincent Ostrom argued so strongly about as an institutional form was it permitted citizens to organize themselves locally, but to have access to a national government for protection of certain rights relative to another governing power. And so it is the check that one level of government operates on another that I think is most distinctive about polycentrism, is the individual directs which center they will access with regard to a particular problem that they perceive. So it is an individual up kind of issue, as opposed to a subsidiarity, which is more a defined making decisions down, often from a top authority. So if the national government said, yes, state, you can do this, that would be more the way I would think of a subsidiary system, as opposed to the state saying, we have the right to do this, get out of my way, federal government. So it's that more check kind of logic that comes from these multiple centers that exist, rather than a hierarchy of dealing with the problems at the lowest level.
So closely related, can you elaborate a little bit more on the relationship of federalism with polycentricity?
Well, again, federalism is, I think, a defined governing structure, and there are polycentric systems in informal arrangements as well as formal arrangements. And clearly a federalist system is going to have at least two levels defined as centers, and where the individual would have access, and sometimes more, depending on whether they define a local level and other levels as well in federalism. a federalist structure. But you don't need federalism for polycentricity. And you can have a federal system that only has 2 levels. It would be feasible to just have the state and just have the national. In a federal system, it would still be federal in that sense, but it would not have the richness of the multiple centers of governing that would lead to true authority and autonomy at these lower levels. Now, I recognize that the state and the national government in the United States are the only true constitutionally defined authorities, but the way in which the states operate has been to sort of pass a certain degree of power down to these other authorities that then, through sort of common law kind of recognition over time, become harder to take away by a state. The state does have authority to decide with their police powers and with their authority within the state to define localities and to define these things. They could wipe all of it out if they chose to, but I think that's hard to do practically over time. So I think federalism is a specific form of government that polycentricity tries to capture across civil and other institutions and other arrangements, and even voluntary arrangements. So your homeowners association could have a certain degree to which it governs you, but only to the extent that they have authority in the courts through contracting and so on. So polycentric could be a bit more, and even in unitary systems, given global networks and other things, you could have considerable degree of polycentricity with regard to a specific type of issue that people have recognized and agreed to be bound by in this social arrangement. How you hold them to it. It's always the international dilemma, right? I mean, we have these arrangements, but how do you hold China to the behavior you want, or the United States, or whatever?
Can you discuss how the knowledge problem applies to some of the concerns which polycentricity addresses?
Yeah, and that is sort of the same as the subsidiarity kind of issue as well. I mean, the key is when you have knowledge problems, as we know, anytime in a social choice setting, one of the real problems is the larger the community, the larger the social entity, the more difficult it is to know what the interests of the individuals in that community actually are. And so if in fact you can drive it down to lower levels by having that as an option for people, and then the capacity to actually choose which governing entities they will be governed by. So that becomes a piece of it too. If you're forced into a community with no capacity for movement, then that is going to be a very different type of arrangement than the one as we talk about in the United States, for example, where you can move to different states, you can move to different communities within a state based on your own choices and capacity. And so when we're moving down in that way, I think that we have a greater familiarity with what are the problems in our area, our own family, our neighbors. It's just an observational kind of thing. We can hold it in our head much more readily than we can anticipate, well, what does it look like in Alabama? What are they doing? And how can I understand how they're addressing this and why they are not wearing masks or why they are not doing one activity or another? And so that's where the knowledge problem, if it can be made locally, is much more likely to lead to less conflict, because now it's not an expert's policy being put on a community that doesn't understand or agree with that policy. And that's where that diversity and subjectivity of preferences come in. it's perfectly legitimate to say that while this is a horrible and a very important problem, it may not be the biggest problem in lots of people's lives. There may be economic issues, there may be other health issues, there may be emotional family issues, and so on, that rise to a higher preference for them. And if the trade-off comes down to those things, they're willing to accept a little more risk from this circumstance than they are to give up all of the rest of it. It's just too high a cost for them to pay. And to the extent that we have that range, any kind of system that would allow those with similar to find each other, and then the people making the policy to reflect that in their decisions, that's going to be a system where there's going to be a closer match. Markets operate in that way. It is the beauty of the market process that we don't know what the price should be. It is discovered in the market. The same thing with policy. If we ever didn't believe that about policy, if we really thought people had the answers and they just needed to put them in place, this circumstance we've just been through should make us question that belief pretty seriously, because it's pretty clear day to day, as much as they wanted to know and as much as they wanted to get it right, because I believe all of them wanted to do it exactly right, they couldn't, because they don't know. And there's so much not to know. And as every day goes by, they know more and more and more and more, and they make better decisions. So when that's just about not like a health crisis, but about, how much are we going to spend on garbage services, then having communities where I just moved from a Virginia community where they had trash services twice a week, and they were huge trash bins that we put out twice a week for them to pick up, and we could barely fill one a week if part way, but we were paying to have them twice a week because that was the preference of our community, and we didn't really get a say in that. Now I'm one where it's once a week, and again, those kinds of things are easier to sort of sort than this, where there seems to be quite a lot of externality and a great deal of uncertainty. And it's unclear that the knowledge that the individuals bring is going to update it quickly enough. But once they know the information, how they react to it will be something that politicians can quickly, I'm willing to accept this much risk from this health problem, even though I know hospitalizations or that, as opposed to locking us down and ruining my business. And we see that kind of tension that's emerging. And those are legitimate demands of individuals within a society, even if public health people don't like that. And that's where the challenge, the idea of one life lost it's enough if we've done this all for one life. That's an insane statement for politicians. They make them all the time. But the reality is, every day we make decisions in our policies that put far more lives at risk, because we can't save every single life without giving up huge other things and losing lives in other arenas. And so that's where I think the knowledge problem, the more we can keep it local, and then good transmission of the knowledge, which is often difficult in a political arena, where you get that tension between experts and politicians in what we should be doing, and how we can best serve the citizenry.
Speaking of transmission, how should we think about and perhaps improve knowledge sharing across localities?
Yeah, well, there are these wonderful pacts, and that's the wonderful thing about sort of Ostrom's work and others work in these areas, in this area of polycentricity especially, is they look at the degree to which people learn from one another, that the communities watch one another. We watch the mistakes that one makes by deciding that they're going to tax at this level, and all of a sudden people start to move out of that community because they have those choices. They don't have to give up their national affiliation, their citizenship, in order to move to Texas from California. And so guess what? They moving from California to Texas, maybe Elon Musk, but Texas, happy to have him. But in any case, the idea that we can operate with reflection on what our interests are, states learn from one another. One of the great things about some of the work that's being done by lots of think tanks around, certainly a lot of people at Mercatus are working on these kinds of things, is various rankings. So how strict are the regulations in your state? How easily did your state address the problem of telehealth or innovation in these areas, or bringing in retired doctors and others, and licensing restrictions that occurred? We saw all kinds of problems around that, and all of a sudden citizens said, why do we have that? Why is that getting in the way? I don't understand it. When it's made in behind, and it's always been the policy, and only the sort of most involved to have a knowledge of it, then you're not going to get them really challenging. But a crisis like this can point a big spotlight on those types of things. And what we've learned is nobody wants to be the very worst. Nobody wants to be in the bottom or the bottom 5 or whatever. So you living in Utah, they were always the least spending on education. I always thought that was pretty good. They perform about mid-range in terms of educational performance, but they spent the very least, or second to Mississippi or whatever. They were always right near the bottom. And people would, oh, we're so cheap. Oh, how can we do that? And I always, well, if you went to the store and you got the same thing and you had to pay 25% less, you'd think that was a great deal. I don't know why you'd think differently in education. But anyway, people felt like they didn't want to be at the very bottom. So anytime you have these ways of characterizing variation and differences, states pay attention to one another. They, oh, well, maybe we should be doing a little of that. And how do I get my numbers up? And you actually see them sitting down with people that are arguing for some of this. It's kind of fun to see that happen as a consequence of some of this.
How should polycentricity inform how we think about exit and voice?
Yeah, that's actually, I think that's the key, is if you don't have the ability to exit and the ability to express yourself with regard to your concerns, if you don't have a capacity for self-governance, which is really what the Ostroms and others were about, and why they valued polycentricity, is it was individually driven. If you can't exit, you can't exercise that. And so you don't get the benefit. Then it's just fragmented and you're forced to stay. So when we had redlining and patterns of discriminatory housing, for example, so you could only live in this neighborhood and only buy homes in this neighborhood if you were of a certain race or a certain group. When you have that type of circumstance, then polycentricity is not going to necessarily solve the dilemma, because you haven't given the real energy that makes polycentricity create better policy outcomes. If people can't vote with their feet, they can't exercise that energy. And so you're going to get very staid. And we see that often with center cities, and some of they got very burdensome. People were able to move out that could move out, and other people sort of got stuck in those communities because they didn't have that same capacity. And so there's actually been a lot of policy discussion about, in housing, should we, if we really want to change poverty and such, should we be giving people subsidies to live in suburban areas, to live in better neighborhoods? Others argue, well, we should have educational vouchers. That's a way of allowing choice when you can't do the whole hurdle of buying a house in the good school district because that's a big chunk of what the value of a house is. Location, location, location is very often a function of the quality of the schools and services in that community. But if you can't make that first hurdle to get into that community, you're never going to be able to take advantage of them. Many of the people, Milton Friedman, others, have argued in favor of any kind of policy mechanism that would allow choice apart from geographic location. You do get into the problem of losing the information of the neighborhood, but you gain perhaps from people doing the information search themselves and voting with their feet. And again, reduce conflict by allowing people to sort as opposed to forcing everyone to adopt the decision that someone deems to be the appropriate one.
Is there a literature within the polycentricity literature about secession?
Yeah, secession is one of those really challenging, both in federalism and in polycentricity. Now, the polycentric logic is there are multiple centers. And as I said, it's not simply a function of government authority that defines these. So we can do these informal networks as well. So in some ways, we have seceded in these things in large part. For example, homeowners associations and co-ops are a way of seceding from the service delivery of the community on a lot of factors. So if you want a level of regulation and uniformity that you are not seeing in your community in terms of the zoning or whatever, you can put up fences and gates around your community. You can provide police services and security services and street cleaning and so on and so forth. So we do see, even within whatever the governing structure is, people choose in some ways to secede from a lot of that and set it up privately on their own. Now, what that potentially does in doing that is it may mean that then they are not as participant in a lot of the decisions along those lines that are being made in the community that's left behind, that's not in the gated community. And so people are torn on whether one is a good thing or not. Should you be able to secede? So all the sort of anarchical arguments are about the ability to form our own voluntary arrangements to do this for ourselves and not to have to be bound by decisions. The little center of Seattle right now, in a sense, has seceded again, to the extent, and not part of Seattle and not being governed by Seattle according to the people that are there, until Seattle decides that's not what's going to happen, or Washington State decides, or the federal government. So one of the challenges of secession is always, are you permitted to leave? And that's where we see the real challenges enter in. What does it mean to leave? Do I get to take the property? Do I get to, many have argued, well, there's a public component. You didn't build that. Other people have contributed to why this area is valuable, and you can't just take it from the rest of the state. So we are entitled to it. So working that out, we saw that with Brexit. It's fine. If you want to leave, fine, but you don't get to leave just scot-free. We have to work out what that means in it. And so that's where the secession kind of logic becomes more problematic. So where it's done voluntarily and you still are paying for a lot of the other things, it's feasible. If in fact you want to take the resources entirely, it's less feasible, because then you have a conflict situation between those who that may have to be worked out in the courts or more contractual arrangement.
How have more local level political actors, cities, counties, regions, done with the virus in terms of planning ahead and, you know, being ready compared to individual states or the federal government?
Well, a lot of them have done a fairly good job. And again, it comes down to, and we can even look at national level too. Sweden is a wonderful example in the European community because it was the example of we are going to behave. They're Swedish, they behave all the time. But we're going to behave while still engaging in all of the sort of normal activities of our daily life, other than to add on this extra wrinkle of being extra cautious about the virus. And they went about their business, and they have not been the worst by any stretch of the imagination in doing that. They have not been the best in terms of it. We may not be able to judge how well they did until we see what happens as others open up. Because again, if this is not seasonal in the way, I think we have in our minds flu always with these kinds of things, where we think it's going to kind of subside. But if it's not that kind of a virus and coming out of our cocoon, then exposes us all over again, then several of these countries that have been very restrictive and closed down may in fact have to deal with it again at this later point in time. And so Sweden may look like having dealt with it all along and starting to build immunity and so on, may be the most sensible pattern that we see. And I think we see that pattern around the United States too, in individual communities. This is, however, because public health is a state issue, this is one where the governors have really come to the foreground and said, we're going to do it my way or the highway. And most of them have been relatively restrictive. And part of it is nobody wants to be the governor that killed off many of his citizens because he didn't do what everybody else was doing. You don't get as much punishment for being overly conservative with respect to this, but you would get terrible press if you were the one that lets your citizens die while others have protected theirs. And so they are not always doing the political calculus in the way we might do a total risk calculus. But yeah, there are communities that have, I think the communities that have done it best are communities where there is a great deal of individual responsibility. So people have said, this is on me. I need to behave in a way that is socially responsible to others, and I can be trusted to do that. So lots of businesses closed and changed their methods long before they were mandated to do it. You know, a week or more before the governor came out and said you have to. And they don't always get credit for that. The reality that they were making decisions that were good for their employees, that were good for their customers and their community. Some are harder, things like schools. It's harder sometimes to, because they're governing entities, and then they have that sort of snowball effect over time. But yes, I think we see many, many examples around the country and around the world that seem to have gotten it more together, but often it's because of the way the citizens responded rather than any particular policy that the government did. The government can do things wrong and make it worse. It can't really make people with authority change all of their behaviors in a health kind of circumstance like this. If they could, we'd all be thinner. We'd all not, I mean, they've been trying for decades. I sat on many of these committees. They always glare at me. You're the problem. But yeah, so if they could impose this, certainly they would have done so by now. New York alone would have been leading that parade.
Mm-hmm. So we have time for one more question, and we will end with this. How would you connect the insights of public choice that you introduced yesterday to the insights of polycentricity?
Well, polycentricity is, I think, a public choice insight, at least the way in which I address it. I think the word has been used by, people in global environmental community and network theory people and stuff. So it's a concept that preceded the public choice movement and gets used in a lot of other science and other fields. But in the way that I've tried to lay it out, where it fits into public choice is, at the end of the day, it's an individually driven and institutionally rich way of thinking about it. And those are the public choice contributions. Focus on the individual, their interests, their incentives, and how institutions shape those. And you can then make predictions and use those predictions to shape making better policy to serve the goals of the individuals as they characterize them. And so that individual becomes the center of all of those centers. And that is the linkage for the Ostroms. So they have access to the national. So in civil rights, for example, they can, when your state is abusing your civil rights, you have access to another center that has authority and power to challenge the power of your governance. And it is that contending powers and multiples of those and the ability to move around and find the ones that fit you best that make this serve individual interests better. And by understanding those institutions, using a public choice lens, I think we can do better public policy.